social prescribing can be defined as the creation of a personalized care plan based on what matters to the patient, and is look at the holistic aspect of healthcare, more specifically, social determinant of health.
Hi, everyone. Before we jump into today's episode, I want to take a moment to give a shout out to my amazing Supercast subscribers. Your continued support means the world to me. As a Supercast member, you get exclusive access to the unfiltered, ad-free video versions of our Health Unchained interviews, raw, real, and packed with insights. You're not just supporting the show, you're fueling the conversations at the cutting edge of healthcare and blockchain innovation. So thank you for being a vital part of this journey. If you're interested in joining, you can learn more about Supercast in the episode description. Now buckle up because today's episode with pharmacist Arun Nadarasa from the UK is going to be incredible.
Remember, the Health Unchained podcast is for informational and entertainment purposes only, and we are not providing any sort of legal, financial, or medical advice. Please do your own research and due diligence before making any important decisions related to these matters. And now please enjoy episode 120 of Health Unchained.
Awesome. Welcome to the show, everyone. In this episode of Health Unchained, we are honored to welcome Arun Nadarasa, a pioneering pharmacist and founder of the International Social Prescribing Pharmacy Association. Arun has been instrumental in integrating social prescribing into community pharmacy, emphasizing holistic approaches to patient care. He is the author of the book Pharmacy Movement: How to Prescribe Social and Digital Medicines. Today, Arun will share his insights on the intersection of social prescribing and blockchain technology, exploring how decentralized systems can enhance patient engagement and community health outcomes. Let's dive right in. Arun, thank you so much today for joining me. I would like you to start by maybe just giving the audience a background of who you are and where you're calling us from today.
Yes, sure. First of all, thank you so much, Ray, for the opportunity to be part of your podcast. It's a huge honor for me. So my name is Arun Nadarasa. I'm a pharmacist based in London, UK, and I've been working as a pharmacist since 2013. And I've been involved in different sectors. For example, I worked in retail pharmacy. I worked in like pharmaceutical. I'm currently working in GP surgery with doctors, which could be a new model of care in UK, in contrast to other countries. And I'm also involved in blockchain project, metaverse project, and social prescribing, of course, and a big fan of education. So on the weekend, I tend to do vaccination training for both clinician and non-clinician. So I guess that's why I get my interest in teaching other people through vaccination, but also on blockchain content and social prescribing content.
That's really amazing. You're doing a lot, obviously. What really drove you to the healthcare world? Like, why did you decide to become a pharmacist?
Yes, of course. I guess many people from my background can relate to. It's like being from a South Asian background, you don't have much choice. At a young age, you're like battered to say you can either become a doctor, a lawyer, or accountant, right? And for me, it was like, okay, I want to be a doctor. So I was basically born in France, came to UK when I was 14 years old in 2002. Unfortunately, I didn't make the grade to study medicine. So basically, when I came, I had a year and a half to do my year 10 exam. I don't know what's equivalent in America, where I got the grade of C and the minimum was B. So I had the choice to either retake the exam or look for similar to the medicine kind of criteria, which was pharmacy, and I went for it.
That's interesting. Yeah, it's funny how sometimes life forces us into certain situations, but looking back, it ends up being the best decision ever or the best situation ever. Not necessarily 100% your decision, but you made the best of the situation. And that's great. That being said, how did you hear about blockchain technology?
Yes, like funny enough, I first heard of the term when I was doing interviews for my book back in 2017. I had the opportunity to do an interview with Denis Silva, who was one of the key influencers of digital health in Europe. And you shout out to her. She was the first person to do an interview for my book. And for this, I'm forever grateful. I'm still keeping in touch with her. And she mentioned the word blockchain. I was like, what's blockchain? And then she broke it down to me. I was like, okay, that's interesting. Then the day after, I had this spark of inspiration saying, okay, I work in pharmacy. I read Bitcoin white paper, so I'm going to write a white paper on pharmacy coin. Released the white paper, and then I think got read 1,800 times in about 20 countries. And at the time, it was the hype of initial coin offering. But because I'm not a techie person, I didn't have the knowledge to launch my coin. It got me to think about the opportunity of blockchain technology for healthcare. And that was back in 2017. And that's so when I founded Pharmacy Blockchain. And my initial business partner, me and him were like trying to work on the business case for it. And then unfortunately, he had to leave halfway through. So as a result, I connected with another pharmacist from France. His name is Dr. Xavier Snyder. We're still keeping in touch now, and he's basically the co-director of the business pharmacy blockchain. So right now it's still like a dormant company, but we're still working on blockchain activities. And once we have a solid business case, that's when we can fully launch pharmacy blockchain.
Interesting. When you say pharmacy blockchain, what is that exactly? I might be missing it.
Yeah, of course. So basically, when I launched Pharmacy Blockchain, it was initially to use blockchain application in the pharmacy world. So I had different use cases, for example, using cryptocurrency to purchase medication from pharmacies, either like brick and mortar pharmacies, that's what I call it in UK, or potentially to use cryptocurrency to buy medication online. But then, as you can imagine, with all the regulation and so on, that never happened. So right now, me and Zach, we're just like doing some, I guess, work undercover. And then once we know the time is right, that's when we can surface and then launch it properly.
Gotcha. Oh, I see. Yeah, I'm looking at it now. Pharmacy Blockchain Limited, right? There's patient login. You can book an appointment. There's a lot of different features here. So very interesting. I'll include a link for everyone who's interested in learning more about that organization. So let's talk a little bit about something called social prescribing. So can you explain what is social prescribing and why
Yes,
is it essential for community pharmacy?
yeah, of course. So basically, social prescribing can be defined as the creation of a personalized care plan based on what matters to the patient, and is look at the holistic aspect of healthcare, more specifically, social determinant of health. For example, to give you use cases, so let's say someone that keeps coming to see the doctor for recurrent chest infection, the doctors will be, oh, you got a chest infection, you got some fever, here's some antibiotic. But then at some point, the doctors, you keep coming and see me for chest infection. Could it be something wrong? So then he made a referral to what we call a social prescribing link worker, which is basically a new member of the team that deal with the social prescribing aspect of healthcare. And the link worker went to the patient house. That was a patient that was like 8 years old. So I found out that the patient had broken windows. And as a result, she was getting hypothermia because of not having
Mhm.
effective heater and broken windows. So all the link work I did was basically get in touch with the council, get the windows fixed, and as a result, the patient was well warmed and as a result didn't get any recurrent chest infection. But this would not have been uncovered if the link worker didn't go to the patient house. So sometimes the problem could be in our surrounding, like the housing situation, employment situation, gambling addiction. The fact that are socially isolated could be also a factor, and then reinforce chronic pain and mental health issue like depression and so on. So that's why I become so passionate with social prescribing because I got a dance background, being a pharmacist, but also a dancer. So yeah.
Yeah, we'll get into your dance background and history. I think that's really fascinating. And it's also a good benefit because dancing definitely helps with health in like almost every single situation. But I just want to talk about the social determinants of health thing a little bit more because that's so important, especially since COVID. Because one thing you mentioned is social isolation. That's become such a problem. And mental health, as we've seen in pretty much every country, has gotten worse since COVID because of partially because of social isolation. And this person, so who had broken windows, do we know why their windows were broken? Did they not notice themselves? I know you mentioned they're 80 years old, but did it take somebody from the healthcare system to find out about that?
Yes, of course. I don't know the full aspect of it because it's more like an anecdote given by my mentor. Her name is Dr. Mary Ann Essam. But basically, I can come across several patients in my GP surgery. When I speak to them, they might say, I've got mold in my house. I've been in touch with the housing association. They're not doing anything. So I could potentially assume that she had a similar situation, try to get with in touch with the housing association. They didn't do anything about it or didn't take it seriously. But then with the involvement of the link worker, the case was stronger because then we had the doctor surgery involved and took it more seriously. But there's so many like hidden problem that patient try to raise, but it's not taken seriously, which is unfortunate.
It is unfortunate. And not only what you said, but also things like diet, exercise. There's so many different ways we have the influence to improve our health. Social determinants of health actually influence more than 50% of your actual health in many cases. We don't have to just say, we can't just blame our genes anymore. That's not something that people can truthfully really do. So at least now that we're becoming more aware of all these social determinants of health, and social prescribing has become part of the lexicon, especially it looks like in the UK. But I think also the United States has started to pick up social prescribing as an important part of the holistic treatment of a patient, or holistic care, I would say. So it's really motivating for me to see that become more and more popular and common. What motivated you to start the International Social Prescribing Pharmacy Association? And what are the goals for it?
That's a funny story. So basically what happened was, so when it's in relation to Dance for Parkinson, which can cover later on, but basically what happened is in 2016, I attended a pharmacy conference and the speaker was mentioning about the need to bridge the gap between health and well-being. And I was listening as an audience member. I was like, okay, so health, pharmacy, being dance, let's combine the two.
Mm.
So I was like, okay. So then I was speaking with my friend next to me. I said, I think I want to launch something called dance pharmacy or some kind of movement similar to that. And look, he looked at me, he's like, dance and pharmacy? Okay, fair enough. But then I was like brainstorming the name and I said I couldn't call my own organization as a one-man army, of course, the Pharmacy Dance Association. It didn't, I mean, for me, it sounded
It
cool,
didn't
but
click.
then, but for professional, like other farms, they like look at me funny, wouldn't take me seriously. I was like, okay, movement of the body, so maybe Movement Pharmacy Association. So that okay, let's go with the name Movement Pharmacy Association. So what will happen? I will turn up to pharmacy event in that year in 2016, make a bespoke badge saying Arun Farm, a movement pharmacist, and people look at me at pharmacy cons like, what's a movement pharmacist? Ah, I'm so glad you asked that question. So, movement pharmacists promote dance for patients with Parkinson. And they're like, okay, that's interesting. And then that's when I decided to write a book on the topic. And when I was doing interviews for my book, specifically on dance for Parkinson, someone mentioned to me, I think Aaron, what you're trying to work on is on social prescribing. I was like, what's social prescribing? And then when I understood the concept, basically dance is just one aspect of it, but then this could be extrapolated to music, a walk in a park, a walk in a museum, painting, singing. And that's when I clicked. So it's only after 3 years since I launched MPA, Movement Farm Association, I rebranded to Social Prescribing Farm Association, so SPA for short. And that was in 2019. And eventually what happened then, I started to do more webinars. I started to travel a bit more. And that's when I had the opportunity to travel to Egypt for the International Student Pharmaceutical Federation, or IPSF for short, which is basically the largest student organization for pharmacists across the globe. And they were holding the annual conference in Egypt. And I attended the conference to talk about social prescribing. So that's when the person that helped me attend the event, I said to her, would you want to be happy to be part of my organization to promote social prescribing in Egypt? And she said, sure, why not? So at that point, it was me and her, which was, I think, in 2022. But then at that point, I had different connection, different pharmacists from different countries. So I had Jenny from Australia, Tarek in Canada, Adam in UK. So I connected with those people and said, would you be happy to be part of SPA as ambassadors to raise the flag of social prescribing in your countries? And they said yes. And then Tarek, who's basically been working as a pharmacist for nearly 30 years, very business minded, he said to me, Arun, why don't you rebrand SPA to iSpa because you have different pharmacists from different countries? I was like, oh yeah, that's true. So that's when we launched the rebrand in 2022. That's how iSpa was born, but the root was MPA, which is basically dance and pharmacy.
Wow. And so I guess what brought you into dance? Was this something you had a passion for your whole life, or?
So that's a funny story, right? In our culture, we have a dance style called Bharatanatyam, which is basically think of it as Indian ballet. And
Mm.
basically, when I was in France, I would go with my sisters when I was like 10, 11, and they would do Bharatanatyam classes. And I would look at them every time because I had to be there as an older brother. I have two younger sisters. And I'm like, I'm keep watching it. It's boring to just watch. Why don't I just get involved? So that's when I started doing Bharatanatyam for 2 years, from 10 till 12. And then what happened was when I moved from France to UK, I couldn't find any local classes for Bharatanatyam. And I was also doing judo. So I said, let me spend more energy on judo. And then what happened is when I joined the University of Bath back in 2006, I was always fascinated in b-boying, where people would spin on the head, do some backflip. And I said, I've been attending at that point like nightclub as a student, and I wanted to look cool on the dance floor. So I was like, let me join the local breaking society. And that's how I started to dance b-boying. But then because I'm quite tall and I've got loose ligament, I kept getting dislocated kneecap. Then I would be limping to classes. I was like, maybe I should shift dance style. And then in 2008, that's when I found out about Krump, which is a dance style originating from LA, which draw inspiration from ballet with some root with clowning and boxing, basically created by 5 people. There's some disagreement, but in my opinion, it's Big Miho, Tad Eyes, Miss Prissy, Lil C, and Dragon, aka Slayer, 5 people. And I like the energy of this dance style. So that's and it was mainly upper body based, so it's less. I was less likely to get injury on my knees, so I decided to shift my dance style from b-boying to Krump. And I was doing it for many years. And then in 2015, that's when I came across the class Dance for Parkinson. I think it was launched in New York by Mark Morris Dance Group in 2004. And I was like, okay, why don't I combine Krump with Dance for Parkinson to become Krump for Parkinson? So I ended up completing the course in 2016, did my first session as a volunteer, where I was leading the class. And I said to myself, okay, that's magical. I can see Parkinson patient that basically shaky, but when they come to the class in a sitting down position, of course, they're like more experienced teacher that's done the session. But for me to do it personally and see the change in the people that no longer patient, but down to us like, how can I take this gift to the eyes of the other pharmacists? So that's why I become more invested to raise awareness of dance benefit for patient with Parkinson. But then this kind of end up in a snowball to where I am right now as the CEO of the International Social Prescribing Pharmacy Association. But it all started off from me being bored watching my sisters and then me trying to be cool in a dance floor in nightclub at university.
What a journey. And like I said earlier, like you don't know where life will take you. So there's lots of decisions that kind of get made for you. And then it turns out they are useful in other situations like here. Krump for Parkinson's. I love it. It's too bad about your hypermobile joints. I have a similar problem. So like my shoulder, I've dislocated. I got surgery on it since. It's been a while, but it's always especially as you get older, you don't want to take the risks of some of these moves. It's okay. I'll just lay back and do some regular dance moves. But it's great to hear that you're still doing it. And I'm assuming you're still big time dancer, right?
So
Maybe
basically,
not the Krump, maybe not the breakdancing stuff, but
let's just say that when I got married in 2018, I left all my dance activity to focus on my family life because I used to spend a lot of money on dancing, like traveling,
okay.
organizing dance event in India, like Indian Krump Festival, and traveled to the World Championship in Germany called the Open Back Session, and also in France for the International Elias Battle, and then went to Japan for King of Buck. Um, but it does cost a lot of money, and then if you do it for hobby, that's fine if you sing it. But the moment you get married, you got family commitments, so you got to take a break on that. So that's when I went full on into social prescribing.
Yeah, and let's talk more about your book, actually. You published it, I believe it was 2018. Is that
That's
correct?
right. Yes.
What have you learned since publishing? So after you publish it, many things have happened. COVID happened. We have lots of different healthcare, societal, political shifts. What can you, are we getting an updated book or what?
So basically, since I launched the book, I've come across many change. Bearing in mind, it's been nearly like 6 years or so. So when I launched the book, initially, a lot of pharmacists in my network, I thought they'd be quite happy to learn about it. Actually, it was the opposite because at the time I was quite ignorant on the funding structure for pharmacies in UK. So basically, people would call my book, that's a spam. You're not allowed to write a book. You don't have the credential. You're not the academic. I haven't had one pharmacist report me to the regulator called the General Pharmaceutical Council saying that Arun has wrote a book. He's not allowed. He's putting the profession into disrespect. And I didn't have a clue until I got a letter from the GPSC saying someone put a complaint about your book, but after reviewing your book content, we can see it's about social prescribing. So there's no clinical content, so it's fine. But just to let you know, it just shows how much
Wow.
hate I was getting from people. And that's because what I was trying to promote is preventative healthcare. But the current budget, the current funding situation in UK and also probably across the world for any pharmacy organization is that the sicker the people are, the more medication they need, and the more money goes to the community pharmacies. And I was trying to say,
Classic.
yeah, and I was saying, hey, you know what? Let's cut down the medication so people are healthier. But then for the pharmacy owners, if they have less medication, I'm getting less profit. So I'm going to hate on you. And funny enough, since then, where I was getting all the hate in 2018, now in 2024, there's been several documentation papers, like even in UK, we had the Darcy reviews that says actually we need to shift the model of care from reactive to preventative, being
Preventative.
proactive, preventing people from being unwell in the first place. And people now are starting to say, yes, social prescribing for pharmacy, that's very beneficial. They're doing webinars. I'm thinking in my head, I've been saying this 6 years ago. You're like bashing me, and now you're like promoting it. And I'm like, okay, anyway, I've done my work, and I'm doing other things with my own association, anyways. But it just shows
Well,
some people shift on the environment. You have a vision, you stick to it, and then magical things happen, right?
absolutely. And thank you for sticking to your gut with this one. I think it's obvious preventative medicine makes a lot of sense and has helped many people and will continue to do so. And I think educating patients and providers as well, really educating them on how to do this effectively is a challenge, but we have to do it. I think otherwise, like you said, the pharmaceutical companies, these basically sellers of treatments of symptoms, it's not really benefiting the patients at the end of the day, and it's actually potentially hurting them in some ways, especially if you look at some of these pharmaceuticals that are being prescribed. I'm a big fan. There's many different ways of social prescribing, as you indicated. It's not just dance. It's not just the food. It's also just being in nature. Sometimes it's that's called a green prescription. I think it's called.
Yes, exactly.
So it's really amazing. Thank you for sticking with your gut.
Thank you. Thank you.
I also know that you launched a Udemy course, Social Prescribing for Community Pharmacy. Obviously, you're an educator. It's clear. How do you see the impact of your online learning course, and where do you see the future of online learning?
Yeah, of course. The reason I launched the course myself was, I would mainly say, out of frustration, because me being a pharmacist back in 2016, I was trying to look for resources available for pharmacists on social prescribing, and there weren't any. And after speaking with more and more people, they're saying like, even at one point called 300 pharmacies in London, saying, would you be interested to get some social prescribing advice on how to get started? And only one pharmacy out of 300 said, "Oh, I know what social prescribing." Others are like, what's social prescribing? So that's when I knew there's a gap in the market in terms of knowledge, and there aren't any to provide us that knowledge. And then it was, I think, in 2019 or so, or could be 2020, I can't remember the exact date. NHS England have a platform called e-learning for healthcare, ELFH, and they launched a social prescribing online course. But I was geared more toward GP surgeries, not pharmacies, like community pharmacies. And I ended up knowing one of the tutor from that course. Her name is Dr. Maria Anessa, which I met previously during my book interviews. I didn't do an interview with her, but I met her at the conference. And I approached her and saying, hi, Dr. Maria Anessa, would you be interested to create a online course specifically for pharmacists? And she was definitely happy to support. But then she said to me, Arun, that's nice you want to do for pharmacists, but why not include the wider pharmacy team so that the course is not just pharmacists, but also pharmacists, pharmacy technician, pharmacy staff. And I was like, oh, that makes so much
Makes
more
sense.
sense. So then after back and forth, I took a camera, edited it, then I launched the course, I think it's September 2020. I think within, I vaguely remember one or 2 weeks from launch, we had nearly 100 students from 25 countries, many of them from UK. So I was like, okay, so it's going well. And since then, I haven't touched it. I just left it. It was always like 30 minutes, short and snappy. And when I checked the current metrics, it's more like today before our podcast, it was actually 1,654 students from 100 countries. And I left it as free because I didn't want money to be a barrier, because there could be pharmacy organizations that may not have the financial means to access to learning on social prescribing. That's why I left it free. And that's based on my work in India for dancing for Krump. But that shows how far it's come, and people are still giving it like 5-star reviews. And also in parallel in 2021 and 2022, that's when I launched the first social prescribing conference for pharmacists. pharmacy workforce, and it's called PSPC, Pharmacy Social Prescribing Conference. And I haven't launched it, I haven't organized in 2022 and 2024 because I've been so busy with my team. But we're planning to reorganize it for next year. And this time it'll be the International Pharmacy Social Prescribing Conference. So that's a small insider, but yeah.
No, that's I appreciate you sharing that. It's obvious that digital health is part of all of this too, right? It's becoming more increasingly part of patient care. Everyone has their app to manage something about their health. What role do you see technology playing for social prescribing?
Definitely. So basically, you have what we call social prescribing is a basic creation of a care plan. You can definitely do paper version, but the problem with paper version is you're not able to measure the level of improvement in that patient well-being. So it's different accredited score. Like for example, in UK we have the ONS4, which is Office of National Statistic 4. There's something that's being used in my GP practice called MyCow, My Concern and Well-being. I think it's owned by Meaningful Outcome, which is a private company. And there's the Wellbeing Star and the Warwick Hindenburg scale and so on. So it's different scale available. Using paper version and trying to keep the content like analog is not a good way to see the improvement at scale. So that's why it kind of created the platform or the field of digital social prescribing. So we had different social prescribing platform in UK. For example, the biggest one is Elemental, which was then acquired by Access a few years back. Then there's the Joy app, and there's many other players in the UK ecosystem. And all other countries like Canada and Australia are looking to launch their own digital social prescribing platform. So basically, the aim is basically at the point of referral, you have follow up, and at each referral and follow up, you can see the improvement. And this could be fed into the clinical system used by doctors. Like in UK, we use EMIS or System One. I think in America is Epic or something on this line. So that's why the integration of social prescribing application with the digital system by doctors is very important because that's how you can combine the clinical aspect with the well-being aspect.
Absolutely. And having that, like you said, digital makes it a lot more easier to develop at scale. And NHS, and even you mentioned Canada, these countries have centralized systems for their healthcare system, right? That is publicly funded. Everyone gets the similar services. In the US, it's different. There's privatization, there's lots of different fragmented services. So I wonder, do you think it's harder for Americans or American communities to do social prescribing, or is it just, does that not make a difference?
So basically, I need to give a shout out to Daniel and Dr. I think it's Adam. I need to check the name. But basically, they're the co-founder of Social Prescribing USA
Hmm.
and Dr. Sigel, I think that's his surname. So basically, they launched Social Prescribing USA a few years back. And basically, they run like monthly community calls. So anyone that's interested in social prescribing initiative can get involved. One of the biggest digital social prescribing platform in America, I think is called Art Pharmacy. And it works in different way. You can either have the referral pathway digitally, or you can have different resources available within a click. Say, I need dance classes, and this comes up. I need swimming classes, and this comes up. So like different type of digital social prescribing platform. And then the biggest one in America is Art Pharmacy.
It's AR
Yeah,
pharmacy.
ART Pharmacy.
Okay.
And I think they do have like different contracts across different states in America. So in terms of is it this?
USA.com. It's you're right. It's Dan Morse and Alan Siegel. Just want to clarify that for the
Yes, I
audience.
think so. Did you find them? Yeah.
Yes, and I'll include links in this for anyone listening here and interested in learning more.
Mm.
So I appreciate that sharing that. But one thing I want to really get to also is, in addition to these technological apps to measure things, one of the concepts behind blockchain and decentralization also is the ability to use tokens to exchange value, perhaps purchase pharmaceuticals, or maybe just reward patients for doing some dancing, maybe, or other health beneficial things. How do we tie this back into decentralized systems and technology?
Yeah, definitely. I think the best way to look at how we can implement it. So, if I understood correctly, is your question to implement blockchain technology into healthcare? Is that correct?
Yeah, exactly. So I want to know, for example, what have you seen out there in the space where there's a certain blockchain based technology or Web3 based technology that's being leveraged to maybe catalyze or accelerate the speed of social prescribing? Like, how can we continue growing the social prescribing community, potentially with the benefit of decentralization as
Yes,
well?
definitely. So I guess there's different layers I can answer to your question. So first, there's something called Sweatcoin that's been running for many years in UK. It's basically rewarding patients for doing exercise and give them some kind of discount from understanding. I'm aware there is another company in America. I can't remember the top of my head. I think they're building a Solana, and basically, it's basically you share your health behavior and then rewarded as a result, or you share your health metrics for the people to buy it. So the way I see it working at scale is definitely number one, regulation. So the regulation to favor the exchange of data, of health data with blockchain, because right now many people associate, unfortunately, blockchain, NFTs, Web3 with like drugs, black market, like similar to Silk Road, right? And people still have that notion, unfortunately. And when you're dealing with healthcare, you're not dealing with system, you're dealing with people, and people tend to be old school. I would even argue.
Mhm.
For example, when I mean by old school, it could be a doctor that's been working for 30 years or 50 years or 40 years, and anything that's blockchain or technology ish, I don't want to learn about it. But then you have the
Yeah.
geeky clinician like myself and others. So that's I'm so grateful that in UK we have the NHS Clinical Entrepreneur Program, which is basically geeky clinician or people that work for the NHS that has an innovative idea and try to bring it to the benefit of the UK population. And being part of this kind of program, we can say, I want to bring blockchain technology. And then you get surrounded by people say, okay, in order to make it happen, you have to do X, Y, Z. They won't look at you and say, forget about blockchain. They actually say, that's the step to take in. And right now, some of the biggest feedback I got is you don't want to have health data on chain because in UK, in Europe, you have GDPR, which is the right to be forgotten. And when we say blockchain, people are assuming, oh, have your health data on chain. But actually, I don't know what's the current situation in America, but in Europe, the patient needs to have the right to say, I want my data to be removed. And if it's on chain, we can't do that. So some of the countermeasures basically having the hash of the health data that's kept off chain, but the hash is kept on chain. That could be one way to address it. I think there was a startup called Medical Chain in UK. I'm not sure if they're still active, but they tried to do it back in 2017, 2018. I don't think they did do an ICO, but I think Hedera is coming along quite strongly in America. They're mainly used for banking, but then they're also looking at the healthcare aspect. But I still, and I think there's also Pharma Ledger, which is more for the supply chain side of master communication. But as so far as I'm involved, I don't recall or I can't off the top of my head any blockchain dedicated to healthcare specifically for health record and so on. And if they have, they can't scale up because of the healthcare regulation and the healthcare hurdle of politics, people mindset, which is going to take time, unfortunately.
Yeah, yeah, absolutely. And for the audience as well, if you're interested, I did interview the CEO, founder of Medical Chain, Dr. Abdullah Al Bayadi, a while back. So feel free to check that episode out. I'm not sure what number it is, but you'll find it. And also pharmacy or pharma ledgers leaders as well. So please do check those out. And thanks for sharing all the examples, Arun. That's really great. And yeah, so as you mentioned, there are many different potential applications here. So I think it's a matter of finding the right target audience and starting to grow that community out. And once there's some adopters, I think there will be over time this understanding of how it can actually be more beneficial to use an on-chain, a hybrid, potentially hybrid chain solution versus simply off-chain solution. Especially when you think about things like identity verification, NFTs potentially to reward these patients. So there's a lot of possibilities. With that, I just want to tell you, Arun, this has been a fantastic conversation. I have a few more questions, and then I think we'll wrap it up. So, if there are healthcare professionals out there, or pharmacists really, who are interested in social prescribing, what advice would you offer them to
So
get started?
definitely based in your country of location, check if there is a local social prescribing organization. Because if you that can name is UK, there's Australia, Canada, America, I know there's one in Singapore, potentially. And if there isn't one, there's nothing stopping to start one. All the resources are out there. There is something called the Global Social Prescribing Alliance They have a playbook available to get you started. And all you got to do is just to start having the conversation. I know there's someone that did that, someone in Portugal. It was just one person, but after talking to several people championing it, like he was able to lead the movement there in Portugal. But it all started with one person. So check if there's an existing organization, connect with them, and if not, start one or have a conversation. You can do webinar, so you can host a webinar with local fellow clinician. You can launch an online event where you have different speakers from different countries to explain the concept so that people that attend in your country can understand the basics and how to get started. You can travel to search prescribing conference from different countries. I know there's one in UK, there was one in America, there's one in Australia. So the opportunities out there, it depends how hungry you are. If you're very hungry to learn, then the opportunity will open up. But if it's just like to learn, then you can get started with online course like the one on Udemy. There's the one from NHS, and there's even one from the World Health Organization. They also have a search prescription course.
I really appreciate that. And we'll put the links for some of those in the show notes. Final question. What is the most influential book you've read?
Think and Grow Rich by Napoleon Hill.
Okay. Any particular reason?
It just blew my mind that the author took, I think, 20 or 30 years to write his book, because I think it was given as a challenge to his mentor, like, okay, if you really want to achieve like success or something, I want you to dedicate the next 20, 30 years of your life to interview the most successful people. And at the end, let's see if you can do it. And he did pull it off. And reading the book, reading the insight from successful people, like the fact that I had this crazy idea sitting down, I want to combine dance and pharmacy, to now nearly 8 years down the line when the CEO of an organization where we have different stakeholders involved. And I'm also in the process became the chair of the pharmacy advisory board at the World Health Service. For me, that's just insane. And the book Think and Grow Rich really highlight the power of truth, grief, and also being perseverance to achieve your goal no matter what. Because I had a lot of doubt, like saying maybe the idea of dance and pharmacy could be too crazy. Should I just still do it? But then I did it and it paid off. So stick to your gut. And this book really teach you that to think big. Because if you go to anyone and say, okay, for the next 30 years, I want you to do one thing and just one thing, and you may not get any financial return from it. Are you able to do it? Most of the people be like, maybe for one day, 1 week, but if I'm getting paid 1 year, but not 30 years. But that's what this book teaches you. Yeah.
Arun Nadarasa, I really appreciate your time today. Thank you so much. I hope the audience enjoyed this very much. Best of luck with the rest of your entrepreneur program at the NHS Clinical. That's really amazing work you're doing there. And yeah, for everyone listening, please do follow, share, comment. I think it's important for us to be the voices for what we believe in, just like Arun did with his organizations. And thank you. Thanks again. Any final words, Arun?
Make sure listen, subscribe to Rate Podcast.
Hey everyone, we would greatly appreciate it if you can take a moment to share your thoughts about the show by writing a review and rating the show on your podcast platform. Your feedback helps us reach a wider audience and enhance the overall quality of the show. Don't forget to encourage your friends, mentors, teams, and students to tune in and subscribe as well. Thank you for your support. Check out healthunchained.org and subscribe to the show on Spotify, Apple Podcasts, and wherever else you enjoy podcasts. Join the premium Health Unchained Supercast community by going to healthunchained.supercast.com, which gets you access to ad-free episodes, and join the official Telegram community group for the latest updates.